Good afternoon again, everyone. We'll start our media availability today with our opening remarks from Dr. Janice Fitzgerald, our Chief Medical Officer.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. I'll start, as usual, with an update on the number of cases in our province. Since the media briefing yesterday, we have 3 new positive cases. 2 cases are within the Eastern Health region and 1 is within Western Health. The public health contact tracing is ongoing. Everyone considered close contacts will be asked to quarantine. The total number of cases in our province is now 247. And by region, we have 229 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 53% of cases are female and 47% are male. We have 20 people under the age of 20, 37 between 20 and 39, 33 between 40 and 49, 54 between 50 and 59, 56 between 60 and 69, and 47 who are 70 and above. 8 people are in the hospital due to the virus, and of these patients, 3 are in intensive care. 159 people have now recovered, and we have tested 5,166 people in total. At this time, I'd like to provide some clarification on what we mean by the term community transmission. One of the most important questions we ask when a person tests positive for COVID-19 or any infectious disease for that matter is how it was acquired. With COVID-19, we could trace cases to a funeral home cluster or to a traveler, and these are actually community transmission acquired locally. However, there are cases for which we are unable to trace the source. This community transmission is of particular concern because it makes it difficult to determine how people contracted the virus and exactly how widespread it is within our community. So to date, 80% of the cases in this province are due to local transmission. 2%, or 5 COVID-19 cases in our province, have unknown transmission. The rest can be linked to a source, such as the funeral home cluster or to a returning traveler. I'm announcing today that we will be broadening our testing for COVID-19. Effective tomorrow, we will begin testing anyone who presents with symptoms consistent with COVID-19 infection. Testing will be expanded to include those who have 2 or more of the following symptoms: fever or signs of a fever, which include chills, sweats, muscle aches, and lightheadedness, cough, headache, sore throat, and runny nose. If it is recommended that you be tested, you will be required to self-isolate. If your test comes back negative, you will still be required to continue to self-isolate until 24 hours after your symptoms have resolved. If your test comes back positive, you will have to continue self-isolation, and public health officials in your region will contact you for advice and follow-up. You can access your test result through the online portal found on our website, gov.nl.ca/COVID-19. Please be advised that it can take up to 5 days for your result to be available. Those who have traveled from outside the province will still be required to quarantine for 14 days upon return to the province. Those who are identified as contacts of a case will be required to quarantine as advised by public health officials. The personal sacrifices we are making to reduce the spread of COVID-19 in our province have no doubt been difficult for all of us, and I want to thank each and every one of you who are doing your part to keep us safe. We miss our families, our friends, and our daily routines. Our children miss their teachers and classmates and their regular activities and social gatherings. Yet, as Newfoundlanders and Labradorians, we are committed to protecting our people and continue to do so despite the hardship we are feeling. While this is our situation right now, it will not be forever. And if we continue to follow public health evidence, including regular hand washing, staying at home as much as possible, especially if you're feeling unwell, keeping a safe physical distance from others, and covering coughs and sneezes, we have limited and will continue to limit the impact of COVID-19 in our communities. The more we adhere to these measures now, the sooner we will be able to be reunited with our loved ones. This time will come, and better days are ahead. If you are not in self-isolation or quarantine, it is okay to go outside and be active. Just do so keeping a safe physical distance from others. Take a drive for a change of scenery. These activities are fine as long as you are only doing them with members of your own household, so staying within your own bubble. If you know someone who is finding it difficult to cope with COVID-19, reach out virtually or call or text. Drop a meal or a baked good to their doorstep. These kind and simple gestures may go a long way in raising their spirits and will let them know that they are not alone. Regardless of our physical distance, we are all in this together, to support one another and to lift each other up when needed. If you are feeling alone or disconnected, please reach out to a family member or friend. You can also call the Provincial Warm Line, 1-855-753-2560, 7 days a week from 9 a.m. to midnight, to speak with a trained peer support worker who is there and ready to listen. If you are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line 24/7 at 1-888-737-4668 to speak with a mental health clinician. This service is available to anyone who needs it. As a recap for those who may have just joined, we have 3 new cases since yesterday's media availability. The total number of cases in the province is 247. The breakdown by health regions brings us to 229 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville. Please know your continued efforts to comply with the public health measures in place are not in vain, and for those who may at times feel helpless in this pandemic, nothing could be further from the truth. With every preventative action you take, you are not only protecting others, but you are helping to save lives. There is no greater, more important contribution you can make. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Well, thank you, Dr. Fitzgerald, and good afternoon, everyone. Well, as it's been already mentioned, yesterday there were no new positive cases in Newfoundland and Labrador, and just 24 hours later, well, we have 3, as Dr. Fitzgerald has just mentioned. 2 of them are in Eastern and 1 in Western Newfoundland. So what we have to keep in mind is that this virus is a resident of Newfoundland and Labrador. It's here. We are not free of COVID-19, and although it's an unwanted resident in the lives in our communities, it is in Newfoundland and Labrador. So let's face it, it's not welcome. I'd like nothing more than to just simply kick it out. But that can only happen if we work together by not moving around. You only have to look no further than what's happening in our country in provinces like Quebec and in Ontario. We have nearly 27,000 cases in Canada. And as of this morning, we are approaching 1,000 deaths in our country. And 50% of those deaths are happening in our long-term care sites. And so we do not want that to happen here. And you look at an example, and then you look at what happened here in our own backyard just a few weeks ago. It's April the 15th, and just a month ago, on mid-March, there was a gathering, and as a result of that, some 178 of those who tested positive in Newfoundland and Labrador were as a result of that gathering just a month ago. So, without knowing it, 1 or 2 people transmitted the virus to almost 200 people in our province. Few people in a public setting, and almost 200 people a few days later were infected. So what I'm saying here is that this virus travels easily and it travels quick. The virus only moves when you move. Do not run the risk of putting your life or the life of another person in danger just because you want something at a store. Ask yourself, do you really need it? Is it essential? Ask yourself, can I go without this item until my next grocery store visit sometime later in the week? Now, we've been working very closely with all levels of government to ensure that the health guidelines that the Chief Medical Officer has put in place, we're working with them to prevent the spread of this virus. And that includes working with our Indigenous leaders in our province. Our history can tell us a lot about the impact of transmitted diseases or viruses and the impact that that could have on Indigenous communities. It can have a grave impact on the people that live there. So to contain the virus and keep it from spreading, Indigenous leaders in our province, they have taken it upon themselves to put additional measures in place. They put in checkpoints as you enter their communities. They're part of the approval process of people that fly into communities through the airplane manifest. So it's an extremely important role in our province, and as our office works directly on issues related to our seniors. The office and Dr. Brake, they make important recommendations to improve the services, which in turn improves the quality of life for our seniors. So we thought that this would be a good opportunity to bring her to the table and speak about the seniors and their families, about the recommendations and the resources that are in place. So she will join us tomorrow and she will address the province, and in the meantime, we will all continue to follow the guidelines that are already in place. Now I know many of you are tempted to go outside and roam around a little as we see some beautiful spring weather across our province. So if you're going outside, as Dr. Fitzgerald just said, do it in the safest manner possible. As Minister Haggie has said so many times, do not go looking for loopholes. Just follow the guidelines, things that make common sense. And if you're self-isolating, you can step outside in your own garden, but please do not come in contact with others. Do not risk your own life or that of others. Simply respect the guidelines that Dr. Fitzgerald has put in place. And in case you have questions, you need clarification, go visit our website. There's a lot of information there of what those guidelines could be and the impact and the decisions that will help inform the decision that you would make on your next actions. It's there you will find the most up-to-date, factual, trusted information related to this virus. And the parameters that we put in place for your safety and the safety of your family and those around you. So they are put there to protect you. So please, do not let up. Do not be complacent. So today we're asking to make that small investment of your time to get to the outcome that we all want. Be responsible, and let's continue to work together to stop the spread. It's the only way that we're going to get through this is by working together. Remember, if you don't move, well, the virus doesn't move. So once again, I take this opportunity to hand it over to Minister Haggie for his comments.
Thank you very much, Premier. As we've seen over the entire course of this pandemic, the situation is dynamic. It changes rapidly. We've gone from no cases yesterday to seeing some further new ones today. And I think the important message here is, as Dr. Fitzgerald has said, as the Premier has emphasised, it's, again, hold the line and stay the course. And whilst the majority of people in this province are doing that, and to them I thank them, it has made a difference, and it's important that we take some comfort from that. Again, it seems to fall to me to highlight some of the things where people may have been less diligent. I've received several emails, quite a lot in actual fact, as the good weather has come, that as the campgrounds and RV parks were shut, people are taking their trailers and finding gravel pits to do there what is not permitted through either the orders or common sense. We have bans on gravel pit camping that actually go back to 2010. Groups of social gatherings of 5 people are the maximum. And quite frankly, if you are going to go and gravel pit, you're going to run into problems from a variety of sources, not least of which will be your health. And I would really encourage you to think long and hard before doing that. I understand the frustration. I have a camper myself. I'm not going to see that for some months yet. And I think really we have to go back to what is essential in our lives at the moment. That is the important thing. We've seen changes around recommendations. We have seen changes from day to day. And it's important that we take those in the spirit of adapting to the new information that we get from our public health colleagues across Canada and indeed across the world. We've seen now that masks have been recommended for those people who are out in public who are otherwise well, who may run into some challenges with physical distancing. But I'd like to emphasize that wearing a mask is not a substitute for physical distancing. That still, mask or no, is your best bet. I've also received correspondence from another essential group of workers who are less used to seeing masks in their environment, and that's from banks. And again, I appreciate the challenges and the security and safety issues around that. But I think, again, we need to look at adapting our way of working to allow for a new reality. A mask in a bank is no longer what it used to be. From the point of view of the expanded testing that Dr. Fitzgerald has referenced, we have seen over the last little while a dribbling in of PPE and essential supplies. And in there, we have the reagents for COVID testing. The Prime Minister only just an hour ago announced that a company in New Brunswick would be very soon capable of producing any and all reagents required for COVID testing for the entire country. And that is certainly a source of great relief to all of us. And it's an example of how private industry, entrepreneurial spirit, research and public need have all come together at the right time. We will also give a shout out today to Polyunity on a very much more local basis. Homemade 3D printed high quality face shields are now actually in use in our healthcare facilities in this province, thanks to a local company, local entrepreneurs and local initiative. And that's another sign that as a group, collectively, we can turn our own skills to making things easier for all of us. So again, I can do no better really than to emphasize again what my other panelists have said. Our success over the long haul depends on keeping together over the short haul. Keep these measures in place, let them do their work, and let time defeat the virus. If we stay put, the virus cannot move. If the virus cannot move, it cannot reproduce, and it will die. It will take time, and that's our greatest challenge, is to rise to the ability to sit this out where we are in place. So stay in your bubble, stay safe there, and don't burst anybody else's. Thank you very much, Premier.
Thank you, Minister, and we now turn it over to the media for questions.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues only. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. We will run through the telephone queue, and I will call each reporter by name to ask questions. Please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and any further questions can be emailed. Our first questions today are from Elizabeth Whitten of All Newfoundland and Labrador. Please go ahead.
Thank you. Many of the long-term care facilities have shared rooms. How are residents expected to maintain social distance, especially for some residents with memory impairment issues?
That's a very good question, and it certainly is a challenge we recognize. The newer homes, such as the ones being built in Corner Brook and in town, the majority of them are now single rooms as a standard. But we do have infrastructure in that area in long-term care and in personal care homes that goes back 30 and 40 years. I think that is a challenge for staff. We have been engaged through the RHAs with advice on how to do that. They have a slightly bigger bubble with 2 people in a room than they would with 1. But the message is still the same. Stay in your bubble. Don't burst anybody else's. And we have worked very hard with the infection and prevention control staff across the RHAs to enable staff to manage in that environment. We are aware that long-term care and personal care homes are our vulnerable spot. They are our vulnerable citizens. And as the Premier has said, if you look across the province, across Canada rather, you'll see that a significant risk is attached to getting the disease in there. That's why we've had a very rigorous clampdown on visiting in those facilities for some time, and now we've changed that even and tightened it with respect to the workers too.
Thank you. And I was hoping to get an update on the current number of ventilators in the province and, if possible, maybe broken down by region.
Certainly. The count I have today is 130 total. There are 17 in Central, 82 in Eastern, 14 in Labrador Grenfell, and 17 in Western Health.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. I'm wondering if there are any recreational facilities that you would consider exempting or opening again at all. So I'm thinking of things like tennis courts and golf courses. Is there any chance that those would reopen?
At the moment, we have not considered that they would be reopening. In a lot of these areas, there would be a chance for people to congregate, and we are recommending that people stay within their bubbles. So we want to reduce that risk as much as possible. So not at the moment.
Okay. And there have been a number of accounts in social media and questions to the media, and obviously questions to all of you as well. But there's a lot of tension going on between people who are in small communities and others who own homes there. What is your advice to both of these groups?
From the point of view of travel, I think you really have to ask yourself, is any travel essential? Is it necessary because you're an essential worker? Is it necessary because of personal health or emergencies? If the answer to any of those questions is no, you should not be traveling.
Okay, thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Today, the Bank of Canada announced a new $50 billion program to help provincial governments with borrowing. Is the province looking to take advantage of this?
Well, as you know, a few weeks ago, on March the 20th, I wrote a letter to the Prime Minister and talked about the difficulty that we had as Newfoundland and Labrador looking to borrow money. So since that time, there's been a number of initiatives, well, two initiatives that we've taken, one that we've taken advantage of, and that was with the Bank of Canada, promissory notes and treasury bills and so on. So we've been able to, since that, borrow some money on our own as well. So right now, if indeed we need to go back to the market for extra borrowing, these new measures that are put in place today will, something that could help and support the province. Of course, we will take advantage of those federal programs. We're always looking for ways to actually, when we need to borrow, to do it and borrow it the cheapest possible way. What that allows us to do, of course, is our debt servicing is lower, which means we can actually have more money to support programs that are much needed in Newfoundland and Labrador.
Thank you. And Trudeau also mentioned today providing help when it comes to essential workers in terms of a money boost. What role will the province play in this?
Well, the details on that are not been. This is something now I know that the Prime Minister has been talking about now for a few days. Even it came up on our call last week, and we'll be talking to the Prime Minister again tomorrow evening. And I'm sure issues like this and topics like this will come up. So as the details are finalized and determined, we'll see what role the province would play in this role. I think is a good idea. What it will do is help support some of our essential workers. But the details around who those essential workers would be has not been fully determined yet.
Thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Thanks. Premier, we've been stressing essential travel only for weeks now, but are we still accepting those who may be leisurely traveling from Nova Scotia, Quebec, or elsewhere who can easily just hop on the Marina ferry? And we heard of the case yesterday where the man from this province was sent home from Nova Scotia, now with iceberg season upon us as well. What are we doing to crack down on people who may be trying to come just for a visit?
Well, the measures that we put in place, they still stand. These are the guidelines that if you're coming to Newfoundland and Labrador for coming into our province, you must self-isolate. So that hasn't changed. And so right now I know that with some recent changes that have been made just yesterday in Quebec about relaxing and removing the restrictions on mining. We're working now with, the airport, let's say, in Walbush and what that would be. So as again, the final details on all of this has not been determined, but anyone that comes into Newfoundland and Labrador from another province, we've been very clear on this, is unless you're an essential worker like the trucking industry and so on, you must self-isolate.
But I guess what I'm trying to ask here is just these people why let these people in who are not essential, I guess is what I'm trying to say.
Well, we've said, from day one or from quite a while now, the importance of essential travel only. Matter of fact, at our airports, we're asking people when they come in, providing them or giving them information of where, why they would be here and so on. There's forms that will be filled out at our checkpoints, no different than we're seeing with checkpoints that we're seeing in Labrador West and so on. As I just mentioned, sharing the manifest with our Indigenous communities. So there are a number of initiatives in place right now. If you're entering or if you're getting on, trying to board a flight, as an example with provincial airlines, they clearly ask you, are you an essential traveler? If indeed, you must be able to answer those questions. So it's non-essential travel is not something that's permitted, and certainly it goes, as we said, all of us have said, it goes with some common sense too. Don't go looking for loopholes and finding ways to jump on an airplane or jump on the Marine Atlantic, ferry to come into our province if it's non-essential. We just simply, it's for essential travel only.
And I don't know if that kind of does my second question, but hearing concerns from workers on board Marine Atlantic ships, they're cleaning and sanitizing at incredible levels, having to work 12-hour shifts, 14 to 15 days straight. They're not allowed to get off on the ferry on either side, then have to come home, immediately have to self-isolate for 14 days, then rinse and repeat, start the process again. Healthcare, other essential workers, like those truckers and stuff, don't have to unless they're showing symptoms. So I guess, for lack of a better term, why the double standard here for these employees?
Yeah, it's difficult. I mean, it's the situation is leaving the province, and just the level of exposure that you would have, to dealing with those people, those travelers, and we realize the difficulty that this is on our workers, but we've had to put in some very strict measures to protect people, to protect their families as well. So we know this is very difficult. We're seeing this with, people that have been traveling back and forth to Alberta as well. They leave the situation that they're into, they come into our province, and they've had to self-isolate as well. So we understand how difficult this is on those workers that work on Marine Atlantic, but as the rules that we've put in place right now, if you leave the province, no different if you leave and you're an offshore rig worker, if you leave Newfoundland and Labrador, when you come back, you must self-isolate.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Can you explain the rationale for the expanded testing? Why are we doing that now?
So we want to make sure that we're finding as many cases as possible. We've had restrictions in place with regard to self-isolation and travel, and people. We've seen the funeral home cluster has now started to die down. So we want to make sure that we're catching every case that we can. And so we've looked at the evidence, and we feel that this is a good time to expand our testing to see if there's any more cases out there that we need to find.
And have you done any sort of estimates or modeling to look at how many cases may be out there, considering there are lots of people who've had symptoms and may have recovered but were never even tested?
The modeling that Dr. Rahman presented last week was based on various levels of what were called attack rates. Those are estimates of a middle range of probabilities. If you look across other jurisdictions, particularly that have had more experience with COVID in the sense it got there earlier, those numbers can vary anywhere from 5% to 78%. So at the moment, we are using that as a guideline for some of our modeling, but it doesn't really work the other way around. What we're doing now with expanded testing, based on, or building on the changing definition yesterday from, or on the 11th rather, from Public Health Agency of Canada, is we are now going to really broaden it to anybody who has any two of the list of symptoms that might make one think of COVID. And I think that will be very informative over the coming days to see what we don't know about where it might be.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Newfoundland and Labrador has a French or bilingual services policy. The provincial government published or put up on its website a self-assessment tool in French yesterday. Published that same tool in English about a month ago. Why was there such a delay in getting that tool up in French?
I wasn't aware there had been a delay. We can certainly look at that. My assumption had been, and if it's wrong, I will deal with that and we can report back. But I'm not sure that I can answer that question immediately. I'll go back and check on those dates for you, Patrick.
Thank you. And I want to ask another question about PPE. Prime Minister Trudeau said yesterday that 1.1 million masks would arrive in Canada over the weekend. Can you give an update on where we're at in terms of masks? And has our burn rate changed? We're talking about the speed at which we go through these equipment. Has that been altered over the past number of days?
Now, our burn rate is fairly consistent. It is actually between 6 and 10 times the rate you would expect to see at this time of the year. We actually only have currently 8 hospitalized patients with COVID, but the biggest other demand is around the need for PPE for testing purposes. We've addressed that with drive-through clinic appointments because they are a much more efficient use of PPE. You use a lot less. From the point of view of actual procurement and supplies, we're getting fractions of the orders that we've put in, but we are matching our burn with our deliveries at the moment. So from the point of view of our most critical, as it were, elements of PPE, we have at least a week in inventory that we know of with our current burn rate.
Thank you.
We will now start a second round of questioning, and we'll start with Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Thank you. As we're getting closer to the tourism season, local operators can't really count on external tourists coming to the province, and they may want to turn to locals. What type of direction will these operators be getting?
Yeah, so from the provincial government's response point of view, I've had discussions with the minister responsible for tourism back a few weeks ago, recognizing that this summer would be very difficult. Did speak to many tourist operators as well, realizing that if the message and we can get to a point where we'll be able to travel safely within our province, we would actually be promoting a stay-at-home vacation type concept so that people in Newfoundland and Labrador would travel more within Newfoundland and Labrador as opposed to people, especially international travels, coming into our province. But it's real early to tell, given to where we are with the history and the evolution of COVID-19. But the plan right now, if we can get to that point safely, would be to promote what would be a stay vacation in Newfoundland and Labrador.
Thank you.
Our next question is from Peter Jackson of The Telegram. Please go ahead.
Hi. How closely do you follow people who have recovered from COVID-19, and have you had any examples of people testing positive again?
So today, people are recovered are followed, until we consider them recovered. If they were to develop symptoms again that was consistent with COVID, they would likely be tested again. However, we have not to date had anyone retest positive after they have been deemed recovered.
Thank you.
Our next question is from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm wondering if it's possible to know how the 3 cases that were announced today were contracted, whether it was through travel, transmission, or unknown at this point.
One was through travel, one's under investigation still, and one case was a contact of a traveler.
Where was the travel, sorry? Which region?
Pardon me?
Was the Western case in travel?
No, the Western case wasn't a traveler.
Thank you.
Our next question is from Ben Murphy of VOCM News. Please go ahead.
Thanks. I know you mentioned how you're gonna start increasing the testing criteria tomorrow, but I believe, and correct me if I'm wrong in saying this here, it was said that as testing numbers go up, the number of false negatives may go up as well. Can you provide us with any stats on the number of false negatives or this retesting?
We don't. Oh, sorry, Jen.
Yeah, so we don't really, false negatives. It's difficult to know for sure. The test itself is very sensitive, but of course, the testing, the process to get a swab to the lab for testing, taking the swab and making sure that the person is at a point in time when they can, when we're going to recover an adequate amount of virus to be able to have a positive test. All of that goes into determining the true sensitivity of a test. And so, that can be a bit variable. We have had some cases that have initially tested negative and then subsequently tested positive. And that may be related to the fact that when we tested initially, it was a little bit too early in the course of the disease to actually pick up enough of the virus to have a positive test. And so that's why, with a high degree of clinical suspicion, we would retest. But it's also why it's so important to ensure that when we are doing testing, that we are doing it at a time when we feel we're going to get the most reliable results. So that is why we have recommended testing only symptomatic people, because we know that when people are symptomatic, they are more likely to be shedding adequate amounts of that virus to be able to be detected on a test. It's a bit more of a complicated question than just simply giving you a number of what percent are sensitive or what percent are false negatives.
Thank you.
Our next question is from Peter Cowan of CBC News. Please go ahead.
The people who have recovered, have any of them been approached in terms of donating plasma to be used for any of the research that's underway for trying to be able to treat people who have the disease using those antibodies from those who've recovered?
I'm not aware of that happening here. We can certainly look into it to see if that is indeed something that is happening at the clinical end of things.
Okay, thanks.
Our next question is from Patrick Butler of Radio Canada. Please go ahead.
I have a question related to the announcement made on long-term care facilities sharing staff. Earlier this week, you announced that nobody who works across sites in long-term care should continue to do so. But we've been hearing directly from some healthcare workers who are continuing to be asked to work by different facilities concurrently. How are you making sure these new rules are applied everywhere in the province?
Well, the long-term care facilities are all managed by the RHAs. So in a situation where a worker would work between two RHA-run facilities, that is easy to identify by the RHA, and they were instructed to cease doing that at some point a couple of days ago. In terms of those people who may work in a regional health authority facility and then somewhere else, whether that's a private business or a private healthcare operation, they are going to be identified and asked to pick a location, and that should be happening and should be complete in very short order. If it's not, then if you've got some details specifically, I'd be happy to look into that for you. Dr. Fitzgerald's order about personal care homes came into effect yesterday, and that's a similar challenge for the operators of personal care homes. And if they need any assistance working through that, we'd be happy to provide it, but I'm not sure that we've actually been asked for that yet.
Thank you.
We have about 18 minutes left before the call ends, so I'm going to give each reporter an opportunity to ask 2 more questions each, and then we'll conclude the call for today. Our next questions come from Elizabeth Whitten of Newfoundland and Labrador. Please go ahead.
In regards to Polyunity being able to make local 3D printed masks, I'm wondering what's the process for testing them to make sure they meet our standards?
That's a good question, and we've always said that PPE has to be up to code, up to standard. I couldn't give you the exact details, but my understanding is that the university were involved in this, and I would be happy to look into that for you. I have been assured that they do meet standard.
Thank you. And I was wondering, would we also be able to get the breakdown for testing by region as well as by gender?
Yes, we can do that. I can read out some numbers for you, or I could just simply supply you with the table offline.
Oh, sure.
Okay, I'll read them out. I take that as a yes. Okay, if you want the rate by region in terms of the number of people tested per 100,000, the number for Central Health is 458 per 100,000. For Eastern Health is 1,239 per 100,000. Labrador Grenfell is 840, and Western Health is 531. These reflect guided, focused contact trace testing, and that's why you see the variations. I think with the change in criteria around diagnosis and the expansion to include anyone now with symptoms, you'll see that distribution change, but that will take probably a couple of days to work through as these criteria will be applied from tomorrow.
I think it's fair too to mention that these are people tested, and some of those people could be tested multiple times, so that even though this is not the number of tests performed, they would be higher than that, given the fact that these individuals could be tested a few times, not just once.
Yeah, good point.
Thank you.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Hi. You mentioned dropping off meals to friends or family. I know personally with my parents in a personal care home that they've discouraged dropping off meals, and there are other parameters. So, are those is it different for personal care homes as opposed to other, just regularly in the community?
So I think personal care homes have made decisions based on what they feel is most appropriate for their situation and their members, and I think we have to respect that. I think, for the most part, when we're talking about this, we are talking about dropping meals off to neighbors and people who may not be able to get out for groceries as often, or may not be able to have somebody get them groceries, and so may need to have a nice cooked meal from time to time. So I think, we have to leave those decisions up to the discretion of the personal care homes.
The personal care homes actually are held to a standard. The regional health authorities inspect them on a regular basis and provide dietary and nutritional advice. And obviously there's food provided 3 meals a day and snacks in a personal care home. I think the issue here is how we support our seniors who stay at home, as Dr. Fitzgerald referenced, in terms of providing them with something they may not be easily able to do for themselves. And quite frankly, it may not just be seniors as well, because there are people in the disability community who have challenges with their own shopping and with their own cooking, and this is a good neighborly thing to do for them too. So I think they're slightly different in comparison there, Peter. Okay.
Well, you haven't tasted my cooking, but anyway, the other question I have is we see a lot of example of disposable gloves, cigarette butts, other sorts of litter, even people spitting right in front of other. I know that maybe that's more of a municipal thing, but is there any way to support that kind of behavior?
It's interesting you should mention that, because one of the biggest things in combating the TB spread at the turn of the last century was public health measures about prohibiting spitting. It's not something we've encountered in significant amounts in terms of complaints, so we have had the odd scattered one. Certainly something to think about. In terms of PPE being left on the ground, we have a huge problem in this province with litter. And it comes out of the snow as it melts every spring, to the point where pretty well every community, certainly my own in Gander and in Appleton, used to have cleanup events. That's not something we can condone at the moment. But, the municipal workers are not there to pick up after you. If you've got a pair of gloves, take them home.
Yeah, thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm just looking for some clarification here. I'm not looking for loopholes, but I'm getting a lot of people asking, because we're hearing go for a drive for a change of scenery, but then we're also hearing don't do any non-essential travel. What are the guidelines? Can I go for a drive around town? Can I go for a drive along the coast? Can't I? I just want to know.
Yeah, so I think when we're talking about non-essential travel, we're saying leaving your home to go somewhere else to stay. Certainly if you want to go for a drive and you're going to go back home at the end of that drive and you're not going to interact with anyone, then that is okay. If you want to go for a drive and you want to go to a nice spot to view scenery, I think as long as, again, you're respecting the physical distancing and you will be going back home at the end of that, I think that's okay. We have to consider that people will need a change of scenery. From a mental health point of view, it's important to be able to get out and feel the sunshine on your face and all of that. So we're trying to strike a balance that protects people, but also will allow people to have a bit of a change of scenery, I guess, and protect their mental health as well.
Thank you. And this kind of backpacking on that one there, with a lot of parks and that shut down within the metro region, a lot of people going out to find trails to hike on, meaning they're going to the southern shore or they're going to other coastal communities to do so. Is there any way that we're going to monitor this? Because now we're going to be seeing a lot of people going to these places, and those that live in those places are quite concerned.
So again, outside, the evidence for transmission in the outdoors when people are physically distancing, they're certainly, that is not a large portion of transmission that happens that way. So as long as people are, when they're visiting, if they're respecting physical distancing, they're not congregating, getting out to enjoy a hike and enjoy the scenery and taking the fresh air and get some exercise is certainly a safe thing to do. I guess considering all the other safety issues this time for your hiking on a trail with muddy areas and water and all of that. So you need to take that into consideration as well. But I think, we certainly know that getting out for a walk or going for a walk on a trail is, as long as you can respect physical distancing, is still a safe thing to do with regard to COVID.
Thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Dr. Fitzgerald, just further to the testing there, our daily numbers have dropped quite a bit over the last few days. Just wondering if there was any particular reason for that.
So a lot of our testing that was done previously is related to contact tracing. The biggest area, the biggest cluster that we've had has been related to the funeral home cluster. That has petered off in the last while, so we certainly saw a drop in the testing that came from the contact tracing in that regard. A lot of people who are travel related are now home, and so they've sort of been past their 14 days. So we're seeing fewer travelers returning who become symptomatic and who are tested. So it's not unexpected that those numbers would drop. Certainly we expect with the expansion of testing that our numbers will our testing numbers obviously will start to rise. We are hopeful that our positive numbers won't rise, but I will be surprised if they don't.
And Premier, you've said previously the power and hydro companies won't be shutting off any utilities throughout all this, but will there be any kind of rate relief for people as they're forced to be home all day with heats and lights on, TVs, computers for children? These bills have to be shooting up.
Yeah, so we're still working right now with the Provincial Department of Natural Resources, with Minister Cody, and with Minister Osborne at the Department of Finance, of course, with our utilities as well. So what we've seen in other provinces have been typically utility bills that have been deferred. They have not been paid for by the province in other jurisdictions, typically as a deferment of payments. So we already have a 12-month, payment plan with our utilities here. So we're looking at what other options we have available to us to, help those customers. I know it's difficult on families. Also know it's difficult on many, small businesses. I hear from a lot of people, but not just about utility bills, but about the expenses in a general sense. Some of these go on and on. And you're right. I mean, as people stay home longer and spend more time inside, is that utility bills is one of the things, that typically increases. So we want to work with everyone as best we can, given the situation that the province is in. So we're trying to be as creative as we can be with those departments to support, our residents.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Premier, the province of Manitoba has reduced the number of work days for their civil servants as they look as a way to rein in their costs. Is that something the province is considering here?
Yeah, so what they're thinking about in Manitoba is, if you look at a typical 5-day work week, is that they would work 3 days, and I think the suggestion is that they would spend 2 days or 2 days a week, I guess, on an EI program or some federal program. And as you know, with the EI program, I think something that's not factored into this is that there is a threshold of what an individual would make, and therefore some of that would have to be paid back at the end of the year. So right now, it's not something that we're looking at to imposing within our own public sector. We still have, quite a few people working. We have, if you look at the province, and when you look at the boards, agencies, and commissions, added together, we'd probably have around 5,000 people. There's about 3,000-4,000 of them directly from the public sector workforce. So we still have quite a few people that are working from home, and so they're working on a 5-day basis. And so our NLTA, our teachers and so on, they are still employed and so on. So it's not something we're looking at right now, because keep in mind that in Manitoba, those workers would be forced to pay back a portion of that EI that they would be claiming on the 2 days that they were receiving EI benefits.
And I've heard from people who support elderly relatives with things like providing care. They may have a home worker, but they may still have to go and see their parents in the evening to help them get ready for bed. They're concerned about the number of people who may be bursting their elderly parents' bubble. It's a difficult situation. What's your advice, Dr. Fitzgerald, on how, or Dr. Haggie, on how people should be managing that? Because they want to give, the parents need care, but they're also trying to not burst the bubble.
I know, it's very difficult. None of this is easy, and there's no one pat answer. I think we want to try to limit the number of people who are coming in to visit through home care, one particular person. So, we would certainly recommend, if at all possible, that home care agencies, or if it's a private home care, that the people who are coming in are consistent. But that's not always within the realm of possibility. So then it's important to screen people as they're coming in, to make sure they don't have symptoms, to make sure they haven't traveled, that they haven't had contact with someone who's a known positive. Those are all important questions to be asking. But, there has to be a balance of providing the care that a person needs with protecting their health. So it's very individualized.
Peter, if I could, and I know the minister spoke to this yesterday, I think for all of us at this table, I think this is one area that we all worry about, because, as Dr. Fitzgerald said, you're trying to balance the care needs of not just the seniors, but those that live with disabilities. You're trying to balance what they need for supports, and yet the level of exposure with COVID-19, and then we also know that there are families out there that they're stressed because they want to be there to support, their family member as well. So there's no question this is a difficult one, and it, as the minister said yesterday, it's one that we think we all worry about, because it is not a simple solution.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead. Patrick, if you have any questions, please press *1.
Oh, sorry, I was on mute. My bad. Wondering how, because of these new, I guess, the enlargement of the rules, how many more tests you could be expecting to do per day? And I'm wondering also, was there a backlog of people who would have been tested, but weren't eligible to because of the previous criteria. Can you give a number of how many people might have been in that scenario, if possible?
So we don't have a number for the second scenario that you talked about, but the and I don't know that we actually have any way we would be able to trace that. But the right now, our lab certainly can handle up to I believe it's 500 tests a day. We don't anticipate that we will see 500 tests a day, but I think we'll certainly see an increase back up to probably likely where we were when we were at the height of our testing, which was around between 300 and 400 a day.
I think one of the confounding things here is around the fact that we are the only province in Canada that has a second spike in the flu season each year, and we have the kind of cold season too. Dr. Fitzgerald references our standard machine, which does influenza-like virus screen as well as COVID. You may recall that very recently we brought on stream another machine dedicated to COVID only, and were that to be the test of choice, we have between the two machines the capacity to do at least 2,600 a day.
Quebec has talked about this week about progressively reopening parts of its economy, recognizing that we're in a different stage of this than Quebec likely. Is this the sort of strategy, progressively reopening parts of the economy, that you would envision for Newfoundland and Labrador?
I think, provincially and federally, there'll be much of the discussion within the next few weeks, working with chief medical officers and their departments, what reopening the economy looks like. We saw yesterday, in Quebec, the lifting of restrictions around residential home construction and the mining industry. So we are connected in some ways, regardless of what one province would do. There's simply, as I mentioned in my opening comments, is that we are connected to what happens within Quebec simply through the airport in Walbush, and that supports and is the entry point for many, workers that would fly in to work in the mining industry in Quebec. So these are discussions that we got to have, and we'll be having those again tomorrow night, as realizing that we are connected, even though we're different provinces. That a decision made in one province can impact another one, as the example that I just gave you. So, whatever this lifting of the restrictions would look like, we'll do it with the advice and the evidence of our chief medical officer, because we can do something today, or another province can do something today that could have a profound impact on our province. So these are the decisions that we make with the advice that we're given by the chief medical officer.
Thank you very much, Premier. The time for questions has ended. Tune in tomorrow at 2 p.m., 1:30 in Labrador, as we look forward to hearing from Dr. Suzanne Brake, the province's senior advocate.